Welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst, and my co-host.
Hey guys, Farida Golombieski here, nurse practitioner at RevitalyzeMD.
So today we have a great podcast because we get these questions all the time, and we like to base a lot of our questions or a lot of our podcast on questions that our patients are asking all the time, because then we know you want to know as well. So this one's on PRF versus PRP and what is the difference between those two. And we've done similar podcasts in the past. But for right now, like and subscribe, because that way you'll get alerts to further podcasts and videos. And we want you to help us grow our channel.
We appreciate it, guys. So hit the bell or subscribe or whatever it says down there.
Hit all the things, So PRP has been around for a long time. It started in the orthopedic industry. And so that's where it kind of started. And then it branched into everything else.
Right? So we like to do all the things here.
All the things with PRP. And we love PRP.
And we love PRP.
It's regenerative and it's awesome. You can use your own blood and all the magical powers that it has in it to regenerate different tissue.
And just because we make advances in medicine doesn't always mean that we get rid of the old. Sometimes we keep the old and we just add the new.
Well, and it's funny because, again, I'll go on to my, advances in medicine are always surgical and medicine, basically, right? And this is like going back to the basics, but this is an advance. It's an advancement for sure, but we don't always need medications and surgeries. And we kind of strongly believe that if we're using medications and surgeries, and if you're cutting, you're probably affecting tissue in some way. So we would rather regenerate. So
whenever we can.
Whenever possible. So PRP is platelet-rich plasma. I'm sure a lot of you have heard of it. We're drawing your blood, we're spinning it down, we're getting the platelets. Platelets have growth factors in them, and then we're re-injecting those growth factors to communicate with stem cells, bring stem cells to the area, communicate with them to get regeneration of tissue, collagen, elastin, blood vessels, nerves, all of the things, right?
And this is something that happens every day in our office, and probably happens in a lot of offices that do aesthetic procedures, because you can add it to so many things to help with regeneration.
So many things,
right? You get a skin pen or microneedling of the face. What should you always do after?
PRP. You can just topically put it on.
Anything that we're making channels or little holes or pinpricks into the face, anything that is opening that up where that PRP can sink in and help with building that collagen elastin is amazing, and should always be done after these procedures to optimize your results, because that's what this is all about.
Results in healing. You get, you're less red if you do a radiofrequency microneedling. You're going to be red after, but your redness and just the reaction to it goes down in no time when you're adding PRP. So just
your social downtime decreases with PRP, which is huge for a lot of our patients. They always want to know, well, what can I do to decrease downtime? Put PRP on it.
PRP on everything and on all the things. Yes. And again, that is, you can't add it to anything. So then you start doing hairs. So we would inject it into the scalp to get regeneration. Basically, we're doing hair restoration because we're taking that hair follicle from a sleeping phase to a resting phase to an active phase, and increasing the active, decreasing the resting. And so now you can stimulate hair growth with it. So it started with all kinds, and then sexual wellness and P shots and O shots and so, but it does the same thing in all those areas, regenerates.
And then tennis elbow, golfer's elbow, shoulders, hips, knees. I mean, we put it everywhere.
There's a lot of ongoing studies. There's 60 plus studies looking at, right now at 12 different orthopedic, injuries that can be used, in non-surgical ways to treat it with PRP injections.
Either treat or prevent or put off surgery, which is pretty amazing whenever we can use our own body to heal itself.
Now back to the question. Now you've heard all about PRP, and that's first generation, and you can see how passionately we feel about PRP. So now do a fast forward to an advancement in regeneration and regenerative medicine. So now PRF is platelet-rich fibrin. So we're still drawing blood, spinning it down. We're spinning it down differently. So we're going to process it differently. So we're not spinning it as high as speed and for as long because we don't want to separate everything but the platelets out. We want to have some other things in there, some mesenchymal stem cells, some white blood cells,
Some red blood
some red blood cells. So there's all kinds of benefit. And again, the most important thing is we're not putting any anticoagulant in it. So we're not putting anything in it. With PRP, we used to put an anticoagulant, so we had prolonged injection time. So now it wasn't forming a clot. We can take that and we can inject and we can take our time with it because it wouldn't form a clot before we injected.
But with PRF, we want it to clot. We want it to be concentrated in the place that we put it.
Correct. So
Which is really important for some procedures and then inappropriate for others.
Still not using that in some procedures because we don't know that that's a safe, use of your blood components to regenerate. So when we don't put an anticoagulant in it, then we have to inject relatively fast. And there's some ways that we can actually prolong our injection time with some further manipulation of the PRF once we draw it out and start to process. But then once we inject, it forms a clot. And so that platelet fibrin matrix stays in place where we've injected it. And it started off at like 7 to 10 days. It's actually maybe like 2 or 3 weeks that it releases those growth factors over time.
Yes. And platelet-rich fibrin has more growth factors than platelet-rich plasma.
Yes, yeah, because you got all the other components and in the blood, in the serum, the plasma that we're using. So, and then it releases the growth factors over time. So it's great under the eyes, great for hair. Hair is amazing.
I mean, that's probably hands down at a PRF, probably my favorite. My second favorite is under the eye.
Under the eyes. Yeah. And then
I love cheek and lip and all of that too. But like if I had to single out one, the hair results that we're having across the board for all patients.
Amazing.
Has been unbelievable.
Amazing.
I mean, we are growing hair in people who have had transplants, who have had, stem cells, who have had all kinds of treatments, exosomes that just are not seeing the same kind of results that they're seeing with these PRF treatments.
Yeah, no, it's amazing. And then under the eyes, of course, is great. And again, you can do it a little more superficially, to help with discoloration in addition to that volume loss and that regeneration.
Which you don't want to put filler in.
No.
I mean, some people do.
Yeah. I mean, you can, but you just got to be in an experienced hands because otherwise it's the most frequent area that is actually treated with dissolving filler because it really just moves because those muscles are moving all the time. You got to get deep to the muscle.
Bunching, and it's just not a pretty look.
No.
Where with PRF, you're using your own blood, your own body's ability to regenerate, and it really helps with darkening. And
the only thing that helps with color is like a PRF or a PRP. But again, not all offices are doing PRP. So or PRF, a lot are doing PRP, but not all are doing PRF, and not all PRP or PRF are the same. So just make sure that your provider knows, the difference between the two
and then appropriate places to use it.
Yes, absolutely. And even when you're using, again, the PRP versus PRF, but also our PRP machines. I mean, we ended up with
we've gone through a few.
Yeah.
We have a PRP graveyard, a machine graveyard.
Yes, yeah, exactly. A few is an understatement for sure. But you want a machine that you can actually get the biggest yield from. So your blood draw has to be a decent amount of volume, but you have to also be able to be flexible with your end product because maybe you want some red blood cells. Maybe you don't want any red blood cells. If you're injecting the face, you wouldn't want any. It burns. It can cause bruising. It can cause discoloration. And so but you want something easy, consistent, reliable, FDA approved. So there's lots of different systems we tried, but we do have one that we absolutely love now.
So you hit on something really quickly about bruising, right? The red blood cells where we don't want them. So I think it's so important to find a injector or a practice that is well educated, that has used these products, that it's not a new product for them, that they're well versed in it, because you don't want to have those red blood cells injected, have them burn, and then have bruising all over your face when it could have been avoided.
Not all PRP is the same. Not all PRP procedures are the same.
Not all PRF is the same. Not all PRF procedures are the same.
Yeah, so everything is different. And so find an office you absolutely love and trust. And then again, one of my favorite treatments in addition to those is just doing like a PRF face where we're taking that.
Yeah, those are great too.
And now you're, putting it in the cheek and you're putting it along the jaw and the nasolabial fold, lips, all the things. And then under the eyes too. So, and you can even do like a little brow lift with that. So it's awesome.
That's great too.
Yeah, we love it. And so we want you to love it too. So let us know your thoughts on this, whether you've had procedures done, whether you have further questions about PRF, like and subscribe.
Hit the bell,
do all the things. And then let us know, likewise, if you want to hear anything else, because we are willing to deep dive into anything aesthetics and wellness. Thank you.
Thank you.